Hey everyone, I wanted to talk about park bench therapy. And there's not really something called park bench therapy, but it's more of an idea. Everyone knows, of my patients anyway, that if you're trying to make a healthy lifestyle change, you have to have mindful practice in addition to exercise and nutrition, and good sleep. I consider sleep part of mindful practice. In fact, a patient of mine asked me, what do I do to prepare for a good workout, pre and post-workout supplements, and one of the best things that I rely on is having a good night's sleep the night before. So part of that problem that a lot of us have with stress and inflammation and high blood pressure and heart disease is the role of inflammation and stress in life. You cannot control being exposed to stress. You cannot control the traffic, can't control the weather, can't control your taxes. Well, maybe you can control your taxes, but the objective would be, if you can do a mindful practice on your own, like in the form of meditation or guided imagery or hypnotherapy, cognitive behavioral therapy, anything out there, twice a day, 10 minutes at least, then your body will experience it and feel real good about it. If you can't do that, and some of my patients can't, mindful practice usually comes in the form of meditation, guided imagery, cognitive behavioral therapy, hypnotherapy sometimes. There's a lot of things that the psychologist can teach you, but I know some of you or some of my patients, it doesn't resonate or it's too hard to sit still. What you can try to consider is coming out to the park. If you get into nature, there's a settling feeling that you get when you're in the middle of nature. Ava Selhub put together this book, and it brought to light how nature can calm you and how lack of nature can make you stressed out. So I think there's some value in it. Even with Shinrin Yoku, and check out my videos in the past, DrRic tutorial Shinrin Yoku, forest bathing. You'll see how if you get into nature on a regular basis, it'll actually lower your inflammatory markers. This is my inflammatory marker, CRP. I'm not sure if you can see that, but it's one of the lowest I have seen with my patients. And it's mine. I don't care if I share it with you, but half of that is because of the nutrition I practice. I'm a semi-vegetarian. I take omega-3 fish oil, but I think the other half is because of the yoga and meditation that I practice. Now, again, I think there's value in it. The studies with Shinrin Yoku show that if you can be in a forest setting for 30 minutes, a few days a week, for a couple weeks, you'll see the markers of inflammation go down. And that CRP of mine is a marker of inflammation. It's heart inflammation. Some of my patients walk around with cholesterol medicines on board, but their heart inflammatory marker is still high. And you wonder, is this because of irritation to the heart? Even if we're on a good diet and on a statin, you still have to bring down that stress reaction. I think a lot of us have a high stress reaction and a really low parasympathetic reaction or a love reaction. So if you can kind of bring down this fight or flight, bring up the love reaction, parasympathetic, you might balance out things properly. You might lower inflammatory markers. You might avoid a heart attack. You might avoid autoimmune disease, diabetes, sleepless nights, anxiety. I mean, if you look at the risk in treatment of all those diseases with park bench therapy, getting out to nature, there's no side effects. Unless you're bitten by a squirrel or there's a flood or a tree falls over, but there's no side effects. So the side effects versus the good effects, I think it's worth it to try. Especially if you have a place around you. Now, if you don't have a pond like this, you can get to a desert, you can get to a mountain, you can get to your backyard if you have a nice scene. Sometimes if you can't even do that, you listen to one of my videos of DrRic tutorial guided imagery or meditation timer. Just see where I've been and you'll see where I put my camera for about 10 minutes, and that might be enough for you. Either way, if it's too hard to sit still or come up with your own meditative practice, or you don't have a psychologist to teach you great ways, get out to the nature at least for 3 weeks straight, 30 minutes if you can, 3 days a week, and see how you feel after 3 weeks. If you have a good feeling, then continue on. Your brain will ask for it. But at least try it. make it part of your practice. If for some reason you do have a good mindful practice, but you're disabled and you can't walk, this too will help be your exercise. It'll help you get out, do something on a regular basis for at least 3 weeks straight. So hopefully this gives you a little bit of guidance on other things you can do to develop your own mindful practice.